Good morning. Hands-on osteotomy. There is a placement of the implants in the mandible. So here the osteotomy has been done. Osteotomy has been done in 5 to 6 places. Here one I have placed the conventional implant. Upon that I have placed the healing cap. So I have placed the healing cap on this one. So another few places osteotomy has been done. I will not discuss about the steps of osteotomy. I will discuss about the placement of corticobasal implants in the lower anterior mandible. I have with me this BCS implant, that is bicortical screw. So these cortical implants will have threads only in the apical end. You can see there are some 4 to 5 threads. So osteotomy is already done. When you are placing an implant in the anterior mandible, always the direction of osteotomy is from the lingual towards the labial aspect. Don't never from labial to lingual aspect, because if you start from labial to lingual aspect, so if you are going to perforate the floor of the nose, means there will be anastomosis of the capillary arteries, so the branches of lingual artery. So if you are going to injure that, there may be hematoma or ecchymosis for the patient. That will resolve by itself, or otherwise a surgical intervention is needed sometimes. So always your osteotomy should start from lingual to buccal, little from the lingual aspect of the ridge towards the buccal aspect. So you have to follow the osteotomy drill pattern, how you have done the osteotomy. So I will place one. This is the not the lengthier one, I think 16 or 70 mm bicortical screw. I'll place this one now with the help of driver. So it's already osteotomy has been done here. I'm placing it. Have a look. However you are comfortable, you can hold the driver. So this is favorable for me. This driver is very good for me. See, it's started to go inside the bone. It has crossed the cancellous bone. It is engaging in the corticals. It's engaging in the corticals. This is a model. You will not have that much of tightness and pressure and stability you want. It's a model to explain. So now I have placed the implant in the anterior mandible. BCS, usually I'll prefer BCS in the lower mandible and the upper anterior maxilla also. So you will get good stability. Okay, so I placed it completely. You can have a look. So you can bend this implant also if needed. For the prosthetic purpose, you can bend this implant. You can bend this. So your implant bending should be such that the implant should not lose its stability and anchorage. So in that way, you are going to place the implant in the anterior mandible. So another one I have is rough surface implant. You can have a look. This is a rough surface implant. Usually I prefer placing these rough surface smaller dia implants of length 18 to 20 mm in the anterior mandible as well as in the maxillary anteriors. So depending upon the type of bone. So usually this rough surface implant will be surface treated and it will be anodized surface will be there. So the first step will be osteomodulation or osteofixation. Then in the secondary intention, osseointegration will happen in both BCS as well as rough surface implants. So I'm going to place this here. So I'm going to can you have a look? So actually abutment is broken. I've used this implant just for prosthetic purpose. Okay, it's going. It will go. Yeah, I'm getting it. You should get good stability. That is the main thing. So here in this mandible, there is one conventional implant placed as well as the BCS implants as well as the rough surface implant. So only thing is a bone should be good. If there is a D2 bone, you will get good stability and anchorage. So anatomical structures you always have to be thorough with before placing the implants. I have explained it in the mandible. Here you can have a look. Brief explanation about the anatomy. That is a pterygomandibular raphe area. This mandibular canal enters through this mandibular canal. So inferior ulnar passes through this. Okay, in the molar area, inferior ulnar runs towards the lingual aspect in the third molar and the second molar area, whereas in the first molar area it runs towards buccally. Okay, so since it runs in the lingual aspect, you have to be careful while placing the implant in the second molar and third molar area. So you can do the narrow bypass technique also. So I have explained those narrow bypass techniques exclusively in my earlier videos. So the brief explanation about placing the implants in the mandible. Okay, so this is one drill which I have used. This is twist drill of 2 mm dia. So this is after the pilot drill you can use this. So this is the type how you place your implants, bicortical implants in the mandible. Thank you.